Good afternoon, good people. I am back with hopefully another helpful tip when it comes to your elderly parents, family members, when it comes to you being a resource for them in case they have questions regarding some things that you should know and they should know towards um, not necessarily their end of life, but things that we should know to assist our parents. So today we're going to talk about a couple of types of insurance that they may have. I think 6 months before your 65th birthday, you are encouraged to go and sign up for Medicare. Medicare is that insurance that most 65-year-olds have. It's that red, white, and blue card that they have. And you have to go and apply. As stated earlier, it is not automatic. You have to go to the Social Security office and apply for that. Most patients have a red, white, and blue Medicare card, but also seniors also have the option to sign up for a Medicare HMO. And with that Medicare HMO, it is Medicare, yes. It offers a little bit more than what your traditional Medicare will offer. But unlike your traditional red, white, and blue Medicare, which you have a standard yearly deductible that you will have to meet before that Medicare insurance will set in, with the Medicare HMOs, you typically have a copay. Most copays will be applied for your doctor visit. You may have a copay of $25 or $30. Most copays for an ER visit may be anywhere from $75 to $100. And then if you have an added benefit for maybe dental or vision, you will also have a copay for that. Most of the time, when you have services that are needed after hospitalization, let's say you may need hospice services. Hospice is paid for by that Medicare Part A. And on your Medicare card, you will see something that says Part A and then Part B. Part A pays for hospitalization. Part B pays for physician offices. If by chance you are in the hospital and let's say you have a terminal illness, then the doctor may suggest hospice. Hospice is paid for by your Medicare Part A. If you have a Medicare HMO, that Medicare HMO will revert back to traditional Medicare. And there's nothing that you have to do. It's all on that hospice company's billing process. That's why I suggest that if your parents have that Medicare HMO, you also have a copy of that Medicare Part A card, because that Medicare Part A card, or that Medicare red, white, and blue card, those numbers and letters is their Medicare number. That number will be needed to verify their benefits. A lot of times, elderly patients will get that Medicare HMO card and then they will just stick that red, white, and blue card in a drawer. Hopefully they won't throw it away, because eventually you may need that. But it's also good, as stated before, for you to have a copy / picture of that traditional red, white, and blue card and that Medicare HMO card. Some patients have TennCare. Now, with that Medicare insurance, you have to work so many quarters during your lifetime in order to qualify for Medicare. With Medicaid, that is a state insurance program. Typically, the patients that have that, those patients may not have worked. Those patients may be below a specific income level. They may have that insurance for their kids, but it's called, and with the state that I'm in, it's called TennCare. In other states, it's just called Medicaid. So they may have Medicaid instead of Medicare, and that's fine. Typically, with your Medicaid, there are certain physicians that you can go to. You may be able to go to a clinic. You may be able to get a doctor at a clinic. You may be able to find a regular doctor that may take that specific Medicaid insurance, but because of the times that we are in now, a lot of times that reimbursement is not very good, and a lot of doctors may not take that Medicaid. A lot of Medicaid patients go to clinics, neighborhood clinics. So the best thing for you to do is just do your research and see if the doctor that you want to go to, if he is a provider, not only on that Medicaid plan, but also see if he's a provider for that Medicare HMO, and see if he's a provider for that Medicare, that traditional red, white, and blue Medicare. Because of reimbursement, a lot of doctors that took Medicare years ago are not accepting new Medicare patients. And I think that's a trend, and that's one reason why they are really pushing for the Medicare HMO plans as opposed to the traditional red, white, and blue Medicare. And then, unfortunately, we do have some elderly patients out there that don't have any insurance. Now, typically, hospitals are not supposed to deny you service regardless of your ability to pay for their services. A lot of times, especially here in the United States, we won't turn you away if you don't have insurance. You can be seen in the emergency room. And unfortunately, a lot of times patients that don't have insurance, they use the emergency room as their doctor's office, which is not good, because then you run into long length of stays before you are seen in the emergency room. You may have to wait 4, 5, 6, 7 hours before you're seen, as opposed to and that's with any emergency room, regardless of if you have insurance or not. A lot of times there are long waits in the ER because of the fact that a lot of patients that don't have insurance will use the ER as their primary care doctor's office. So I wanted to speak on that because it's November. It's open enrollment for most insurances, whether you have a commercial insurance or if you have Medicare. So when the time comes, you may want to sit down with your parents to see which plan is actually better for them. We do have people that are fortunate enough to have a Medicare plan, and then they have a secondary plan, which may be a commercial insurance where they retired from. My mom retired from Bell South. Her secondary plan is with Bell South, but unfortunately now a lot of places are not offering pensions. A lot of times now people are not staying with companies for 35 or 40 years like the baby boomers did. So then you run into the point of Do I need a secondary insurance to offset some of the costs for my Medicare? That's a decision that you would have to make. There is a cost for that. So you may want to sit down and help your parents with that decision also. A lot of times patients and a lot of times people can't afford that secondary insurance and they would just have their traditional Medicare, which is fine. But whatever your Medicare does not pay for, just like if you have commercial insurance, whatever your commercial insurance does not pay, they're going to send you a bill. So whatever your Medicare does not pay, and if you don't have a secondary insurance to offset that cost, then you will get a bill. Okay? Just wanted to throw that out there. I just wanted to talk about some of the insurances that our parents may have. Like I said, it's open enrollment. You may want to sit down with them, discuss with them, see what their options are, see if you can help them, because I know it gets very confusing. And I know when these HMOs first came out, people were getting phone calls left and right. People was, I don't want to say they were being switched, whether they gave approval or not, but they were being switched to these HMOs, and they were promising them the moon and the stars and the heaven above. This is what your insurance would do, yada yada yada. And the insurance was not doing that. They were not covering everything that they said that it was covering. So just be on the watch and on the lookout for that. Make sure whatever plan you do choose during this open enrollment season is the best plan for you and your loved one. Now, I am giving you everything based on my opinion. This is what I think you should do. I don't work for an insurance company. I work in healthcare. Just tidbits of information that I think will be helpful for you and will be helpful for you to navigate with your family, your parents, your aunt, whoever may need some help. Okay? If you have any questions, please comment below and I will try to answer. And I may not know the answer. I may tell you to Google it because I don't know everything. I promise you I don't. I'm just trying to help out some of the elderly people that have questions, but they may not know where to go and get the answers. Okay? Please remember to like and subscribe. And this weather is still gloomy. It's been gloomy all week. And hopefully next week the sun will come out, as the song goes. Maybe the sun will come out tomorrow. And then maybe the next time I get on here, we can have sunshine. Maybe I can walk in the park. But until then, I will be inside and probably talking from my car. All right? Everybody have a great weekend, and we will speak soon. Bye-bye.